I'm going to try to convince you that some of the biggest problems faced by the seriously mentally ill are as a result of what we do, that we are the problem, that we are misleading government officials, and that is why the seriously mentally ill can't get treatment. I am going to try to convince you that we fail the seriously mentally ill when we mislead government officials into denying violence rather than taking steps to reduce it. We fail the seriously mentally ill when we try to convince government to spend on improving mental wellness in the masses rather than delivering evidence-based treatment to the seriously ill. And we fail the seriously mentally ill when we try to convince government that it is stigma rather than lack of services that presents the major barrier to care for the seriously mentally ill. Now let me explain why what I'm saying is different than most mental health advocates claim. I am not a mental health advocate. I am an advocate for the seriously mentally ill. To put that in perspective, 100% of the population can have their mental wellness improved. 18% have something that's in the Diagnostic and Statistical Manual, but only 4% have a serious mental illness, meaning one that creates a functional impairment that inhibits their ability to engage in daily life activities. Now, we can argue whether it's 2%, whether it's 6%. The boundary may be debatable, but the extremities are clear. If you think the FBI planted a transmitter in your head, chances are that's serious mental illness. John Hinckley shot President Reagan because he knew, not thought, he knew that that was the absolute best way to get a date with Jodie Foster. That is serious mental illness, and we are failing people with it.